वेलकम टू आर के ईडू नेक्सस। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्cet, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। Join us regularly to make sure your selection.
Which of the following is the one and only mobile or movable bone in the skull? A. Maxilla. B. Mandible. C. Ear ossicle. D. Frontal.
And the answer is option B. Now, imagine your skull as a fancy house, with all its bones neatly arranged. Among all the bones in your skull, there's one bone that loves to party and shake things up. Can you guess who it is? Well, it's none other than the mandible. Cue drumroll. The mandible is like the rock star of your skull. It's the bone that holds your lower jaw and is responsible for all your jaw-dropping moves, like chewing, talking, and even singing in the shower. So, remember, when you think of a bone that likes to groove, just shout out loud, "It's the mandible, the movable bone in my skull." And never forget, learning can be fun and funny too. Keep on laughing and learning.
Which of the following options correctly defines sinuses? A. Cavities in the bones. B. Nasal cavity. C. Nasal blockage. D. Space between tissues.
And the answer is option A. Cavities in the bones. Because sinuses are the empty spaces or hollow areas within the bones of your head. They are not the nasal cavity option B itself, although they connect to it, nor are they related to nasal blockage option C directly. And they are not spaces between tissues option D. Instead, they are specifically the hollow areas inside the bones of your head. Imagine your head is like a box made of bones. Inside this box, there are some empty spaces called sinuses. They are like little caves or pockets in your skull bones. These sinuses are connected to your nose, and they play an essential role in helping you breathe and keeping your head light.
Which of the following options correctly indicates when the ossification of anterior fontanelles completes? A. 3 months. B. 6 months. C. 12 months. D. 18 months.
And the answer is option D. Let's break it down in simple language. The anterior fontanelle is a soft spot on a baby's head where the skull bones have not yet fully grown together. It's also known as the soft spot. During a baby's early life, the skull bones are not completely fused, allowing the brain to grow and the head to pass through the birth canal during delivery. Now, the question is asking when this soft spot, or anterior fontanelle, becomes fully solid or ossified. The correct answer is option D, which is 18 months. By the time a baby reaches 18 months of age, the anterior fontanelle has usually closed and become hard or solid.
Which of the following is the kneecap? A. Femur. B. Fibula. C. Patella. D. Tibia.
And the answer is option C. The kneecap is also called the patella, and it is a small, flat bone located in the front of your knee joint. It acts as a protective shield for the knee joint and helps with the movement of your leg. When you bend or straighten your knee, the patella slides up and down in a groove at the end of your thigh bone, known as the femur. This movement helps to improve the efficiency and stability of your knee joint while you walk, run, or do any other activities that involve your legs. So, the correct answer is option C, which is patella. It is the bone that forms the kneecap and plays an essential role in keeping your knee joint strong and functional.
Five. What is the correct function of a ligament? A. It connects bone to muscle. B. It connects bone to bone. C. It connects muscle to muscle. D. All of the above.
And the answer is option B. Imagine your bones in your body like the framework or structure that holds everything together. Now, bones don't just float around, they need to be connected to each other to keep your body stable and allow you to move properly. When you move, the ligaments keep your bones in the right position and prevent them from slipping or sliding too much. They provide stability and limit excessive movements that could cause injuries. That's why the correct answer is option B. Ligaments connect bone to bone.
Six. Which of the following options correctly describes a tendon? A. It connects bone to muscle. B. It connects bone to bone. C. It connects muscle to muscle. D. All of the above.
And the answer is option A. Certainly. A tendon is a tough and flexible band of tissue in our body that serves as a connector between a muscle and a bone. Think of it as a strong rope-like structure that attaches our muscles to the bones they need to move. When our muscles contract, shorten, they pull on the tendons, which then pull on the bones, allowing us to perform different movements like walking, running, or picking up objects. So, the correct answer, option A, is it connects bone to muscle.
Seven. Which of the following is the strongest ligament in the body? A. Iliofemoral ligament. B. Lacunar ligament. C. Ligamentum flavum. D. Inguinal ligament.
And the answer is option A. This ligament plays a crucial role in providing stability and support to the hip joint. It helps to prevent excessive extension, backward movement of the hip joint and limits excessive rotation of the thigh bone. It also helps in maintaining an upright posture while standing or walking. The iliofemoral ligament is composed of strong and dense fibrous tissue, which gives it its strength. Due to its strength and important function in hip stability, the iliofemoral ligament is often referred to as the strongest ligament in the body. Therefore, the correct answer is option A, iliofemoral ligament.
Eight. Which of the following is the most prominent cartilage found in the larynx? A. Cricoid. B. Thyroid. C. hyoid. D. Epiglottis.
And the answer is option B. Imagine the larynx as a structure in your throat that helps you produce sound when you speak or sing. Think of the thyroid cartilage as a shield-shaped piece of cartilage in your throat. You can feel it by gently pressing on your Adam's apple. The thyroid cartilage is more prominent because it forms the front part of the larynx and helps protect the vocal cords and other important structures inside. The other options, A. cricoid, C. hyoid, and D. epiglottis, are also cartilages found in the larynx, but the thyroid cartilage is the most noticeable one. It's like the superstar among the cartilages of the larynx because it's the one you can easily feel and see when you touch your throat.
Nine. Which of the following terms refers to the repair and reconstruction of the joint? A. Arthrodesis. B. Arthroplasty. C. Arthrotomy. D. Amputation.
And the answer is option B. Arthroplasty is the term used to describe the repair and reconstruction of a joint. Let's break it down. 1. Arthro refers to the joint. It comes from the Greek word arthron, which means joint. 2. Plasty comes from the Greek word plasion, which means to mold or shape. So, when you combine arthro and plasty, it means to shape or mold a joint. In the context of joint repair and reconstruction, arthroplasty involves different surgical techniques that aim to restore the normal function of a damaged joint. It can involve replacing all or part of the joint with artificial components, reshaping the bones around the joint, or repairing the damaged tissues.
Which of the following is the correct term for the abnormal lateral deviation of the vertebral column? A. Lordosis. B. Kyphosis. C. Scoliosis. D. Osteoporosis.
The correct answer is option C, which is scoliosis. Scoliosis is a medical term used to describe the abnormal lateral, sideways, curvature of the vertebral column. It can occur in various degrees of severity and can lead to an uneven distribution of weight on the spine, causing it to bend sideways. This condition can be congenital, present at birth, or develop later in life. Let's briefly explain the other options. A. Lordosis. Lordosis is an abnormal inward curvature of the lumbar, lower, or cervical, upper, regions of the vertebral column, causing the affected area to curve more than usual inwards. B. Kyphosis. Kyphosis is an abnormal outward curvature of the thoracic, middle, region of the vertebral column, leading to a rounded or hunched back appearance. D. Osteoporosis. Osteoporosis is a condition characterized by weak and brittle bones, typically due to a loss of bone density, making the affected bones more prone to fractures. The term scoliosis comes from the Greek word scoliosis, which means crooked or curved. It accurately describes the lateral deviation of the vertebral column, making it the correct answer in this context.
And for additional query search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.